Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Not true about the bacterial drug resistance mechanism is in bacterial drug resistance mechanism the most common mechanism is production of neutralizing enzymes. Um, yes, if resistance is If resistance is plasmid mediated, it is always transferred vertically. No, actually, if it is plasmid mediated, it is transferred horizontally by conjugation, not vertically. Alteration of target is seen in pneumococcal resistance. No, alteration of target is um, Yes, it is seen in pneumococcal resistance. I'm sorry. Alteration of target is seen in pneumococcal resistance. That is, penicillin binding proteins are used for alteration of target, which is used in pneumococcal resistance. Complete removal of target is cause of resistance to vancomycin. Yes, in the vancomycin, the target site is D-alanine. D-alanine is the target site. So when this D-alanine is removed, so it is removed. So then, because how is it removed? This D-alanine is converted to D-alanyl D-lactone. Because it is converted to D-alanyl D-lactate, so obviously this is not there. So there is decreased affinity. Okay, so all these are resistant mechanisms. Thank you.
thank you and thank you for watching.